Okay, I have my vitals on the pink card and my cheat sheet on the blue card. I'm gonna take a look at this before I start. Okay, I'm ready to start. I have all of my tools today, which is the stethoscope, pen light, Rosenbaum chart, and the tone compressor. So I'm going to start by showing you the vitals. There's nothing else on there. Okay, you can come in. Okay, my name is Kristen and I will be your nurse today. We're going to be doing a head-to-toe assessment, and I've already closed the door and blinds for privacy. Starting off, I'm going to read her vital signs, which were already taken. Her blood pressure was 120/80, the pulse was 60, respiratory rate was 16, O2 saturation was 99, and her temperature was 98.6. Are you having any pain? Zero, okay. So zero pain. Her weight is 120. Height is 5'3", and her BMI was already calculated, and it equals 21.3. Okay, I'm going to start by general inspection. She is clean and healthy. She has adequate hygiene. How old are you?
20.
And what is your race?
Caucasian.
Okay, the patient, her appearance correlates with her stated age and race. Can you state your name for me?
Isabel Sanders.
Do you know where you're at?
Home.
And what time is it?
11:30.
Okay. She is awake, aware, and oriented to time, place, and person. Her gait was smooth, coordinated, and balanced. She had good mobility. She had no deformities, no irregular movements, or mobility aid when she walked in. So that indicates good gait. She has upright posture. She's able to speak, respond, comprehend, and follow simple directions. What is your primary language?
English.
Okay, her primary language is English, so we won't need an interpreter. And her voice is well articulated, and she has a full and clear voice quality. She is dressed appropriate for the occasion. She dressed appropriate for the weather before we changed into her gown. And her mood is relaxed, cooperative, and she's very relaxed. Okay, we're going to move on to the inspection. I'm going to inspect her skull. I'm going to see if there's any lumps or bumps. I don't feel any lumps or bumps or lesions. Is there any tenderness when I palpate?
No.
Okay, no tenderness reported. Her head is normocephalic, contour is round, and the skull is symmetric. Her hair is naturally brown. Texture is a little dry, but overall healthy. Her hair has been chemically altered, and it's evenly distributed. There's no signs of loss of hair growth or anything like that. I'm gonna now inspect her face and her skin. Her skin color is appropriate for the stated race, which is Caucasian. She doesn't have any discoloration. Her skin color is evenly distributed. I don't see any major blemishes. Her facial features are symmetric with her head. She has no facial weaknesses. And I don't see any deformities or anything just by observing. I'm going to feel the temperature of your face. Is any of that tender?
No.
Okay, no tenderness reported. Her skin is warm, moist, and it has smooth texture. I'm now going to palpate the bony structures. You feel any tenderness?
No.
Okay, no tenderness reported. The bony structures are symmetric, and there's no deformities in the bony structures. We're going to do your T and J. Can you open your mouth and then close it? Was there any tenderness?
No.
Okay, no tenderness reported, and no crepitus was felt. So her TMJ is intact and well. I'm gonna have you clench your teeth. Okay. Was there any tenderness with that? Okay. No tenderness with her cranial nerve 5, and that is intact. I had her clench her masseters. Okay. I'm now gonna have you raise your eyebrows real high, do a real low, smile, frown, and blow your cheeks out. Okay, that was testing for cranial nerve 7, which that was intact also. I'm going to make sure I did everything with your face before I move on. I believe that I did, so I'm going to move to your eyes. Okay, I'm going to do the pulses first. Okay, I'm going to do all of the pulses. I'm going to start with the temporal. Okay, we move to the carotid, only one at a time. Okay, I'm going to move down to the brachial pulses. Radial pulse. Okay, posterior tibialis. And the dorsal. Okay, all pulses were equal and equal bilaterally. They were +2 plus amplitude, and so now I'm going to do her lymph nodes. I'm going to go ahead and knock that out. So we're going to do preauricular, postauricular, occipital, submandibular, tonsillar, submental, sublingual, anterior cervical chain, posterior cervical chain, and then I'm going to do the supraclavicle and then the infraclavicle. Was there any tenderness with that? No. Okay, no tenderness reported, and none of the lymph nodes were palpable. Okay, now I'm going to move to your eyes. First, I'm going to look at the eyebrows and eyelashes. They are even and symmetric. The hair distribution on both are the same color as her hair color, which is brown. They're evenly distributed in hair growth. Her eyelids are the same color as her face. There's no abnormal colors. The position, blinking, and closure of her eyelids are all equal, and there's no abnormal movements with those. You're going to look at your eyeballs, and then your sclera is white with no lesions. The iris is green and round, and the eye color is equal also on both sides. I'm going to look at your cornea. Okay. Okay, the cornea is clear and transparent. There's no cloudiness. I'm going to go ahead and do the corneal light reflex. Okay, those were both equal. That's good. I'm going to move to the Rosenbaum chart. If you can hold this out for me and cover one eye. Can you read the lowest line?
428,739.
Okay, swap hands.
428,739.
And can you do both eyes?
428,739.
Okay, no issues with that. Okay, both eyes are 20/20 vision, and that was testing cranial nerve 2. I'm going to also test cranial nerve 2 again with the peripheral exam. Can you cover your eyes? Tell me you see my fingers. Yes?
Yes. Yes.
Okay, swap.
Yes. Yes. Yes.
Okay, cranial nerve 2 is intact. I'm now going to move to eye movements. Can you follow the spin without moving your head? All right, that was tested for cranial nerves 3, 4, and 6, and those are intact. And now I'm going to do Perla, which tests for cranial nerve 3. First, I'm going to start with accommodation. Can you look at the end of this pin, then look at the wall? Okay, look at the pin again, and follow it in. Okay, and then I'm going to do your pupillary response and consensual reaction. So I'm going to do pupillary response, consensual reaction. Pupillary response, consensual reaction. Okay. The pupils were equal. They were equal and reactive to light and accommodation. Yes, they were equal and round and reactive to light and accommodation. And that was cranial nerve 3. And I believe that was it for the eyes. Gonna double check. Yes, I believe so. If not, I'll go back. Okay, I'm gonna move to the ears. First, I'm gonna start by inspecting the ears. They are equal to the head. The skin is intact. There's no lesions, no erythema, no redness. Okay, I'm gonna palpate the ear and the mastoid area. Is there any tenderness? No. Okay, no tenderness reported. There was no edema and no erythema. I'm now gonna look for discharge and lesions. Okay. Okay, no discharge or lesions in the inner and external ear. I'm going to test cranial nerve 8, and we're going to do the hearing test. Can you cover one ear and then repeat what I say?
Dog, cat, fish.
Okay.
3, 4, 5.
Okay, cranial nerve 8 is intact, and that's good. I'm going to move down to your nose now. Nose is symmetric with the face. It is midline. There's no deviated septum. Septum is midline also. I'm going to palpate. Tell me if you feel any tenderness.
No.
Okay, no tenderness, no edema felt. There's no lesions, no abnormal color into the face. It's all even with the skin. Okay, I'm going to look at your nose for any foreign bodies. No foreign bodies, no lesions, no discharge. Can you do one nose? Okay, patency is clear. Now I'm going to move down to the mouth and the lips. The lips are pink and moist. There's no dryness, no lesions, no fissures, no crust or anything. I'm going to look in your mouth now. Can you open your mouth and stick out your tongue? The tongue is pink and moist. It is symmetric, and it's symmetric in movement also. I'm going to look at the top of her mouth at her hard and soft palate. That's intact, that's pink and moist. And then the floor of her mouth is also pink and moist, and it is intact with no lesions. I'm going to look at your cheeks. The buccal mucosa is pink and moist. There's no lesions. I don't smell any foul odors coming out of her mouth. I'm going to go ahead and test your gag reflex and check your oropharynx at the same time. Okay. You stick out your tongue and say, ah. Okay, uvula moved as it should. It was appropriate movement. It was pink and moist, no lesions. And I'm going to test your gag reflex. That was really fast. That was testing cranial nerve 9 and 10. And I'm now going to have tests for cranial nerve 12. Can you stick your tongue out for me? And go up, down, side to side, push it in your mouth. Okay, cranial nerve 12 is intact. And I'm also going to have you swallow for me. Okay? Was there any difficulty swallowing?
No.
Okay, no difficulty swallowing. That tested cranial nerves 5, 7, 9, 10, 11, and 12. Those are all intact. I believe I did everything I needed for the mouth. If not, I'll go back. Okay, I'm going to move down to the neck now. I'm going to first start by inspecting. The neck is evenly distributed in color. It's symmetric. There's no discoloring in the creases or anything. I'm going to palpate for any tenderness. Is there any tenderness there?
No.
Okay, no tenderness reported, and there was no edema or anything. I'm going to inspect the trachea. Is there any tenderness?
No.
Okay, trachea is midline. There's no shifting or any abnormal findings. I'm also going to palpate the thyroid. Okay, can you swallow for me? Okay, the thyroid was not palpable. Was there any tenderness?
No.
No tenderness. I'm going to go back and check your teeth. I just remembered I did not do that. So can you smile for me? Okay, the gums are pink and moist. The teeth are clean and white and straight, which indicates that she has good hygiene. Also, again, there was no foul smell. I'm going to count your teeth. Okay, Okay, looks like she has 32 teeth. They're healthy. As I said, good hygiene. Okay, now that I have finished the neck, I believe, in case if I forget, I'll go back. I'm gonna now go to the anterior chest. Just from inspection, I see even skin. There's no lesions, no abnormal coloring in her skin. I'm now going to palpate the bony structures. I'm going to palpate the clavicle, the sternum, and the anterior ribs. Any of that tender?
No.
Okay, no tenderness reported, and no deformities. Okay, can I have your shoulders? Good. Go against me. Okay, that was cranial nerve 11, and her shoulder muscle was also 5 out of 5. I'm going to also have you do your neck forward, do it back, side to side. You turn your head and roll it a little bit. Okay, she has full range of motion in her neck region. Now that I have palpated your bony structures, you said that there was no tenderness. I'm going to observe the chest. Your breathing, you have effortless breathing. There's no extra work of breathing. I don't see any retractions, sighing, or any heaves, thrills, or pulsations or anything like that. I'm going to listen to the 8 points on her anterior chest with my diaphragm, and I'm just going to have you breathe in for each time that I touch your point. Okay? Okay, as I said it before, I did not see any retractions or anything, and I also did not hear any adventitious sounds. The lung sounds were clear, were in clarity. Now that I have gotten that out the way, I'm going to listen to the heart sounds. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve with my diaphragm and my bell. Okay, I'm starting with the diaphragm. I'm doing the aortic for 10 seconds. The pulmonic. Erb's point. The tricuspid. And the mitral. Okay, I heard no abnormal sounds. Her S1, S2 was regular and rate and rhythm. There was no murmurs, no any abnormal sounds like that. I'm going to also check the apex of the heart for the apical pulse. Okay, the apical pulse was 2 plus amplitude. It was present, which is good, and it was regular rate and rhythm. I'm also going to go back to the heart with my bell because I did not do the bell. For 10 seconds also. Okay, as before, I did not hear any abnormal sounds. The S2 and S1 were S1 and S2 were regular and right in rhythm with no murmur, no skipping or anything like that. Okay, now I'm going to move to the posterior chest, and I'm going to listen. First, I'm going to observe her posterior chest. The skin is evenly distributed. The chest, anterior chest and posterior chest are symmetric. I did not say that. I don't see any, extra work of breathing back here. I don't see any signs of retraction or any pulsations, thrills, or anything back here either. From what I can tell, the spine, I don't see any curvature of the spine. I don't see any dimples. I'm going to palpate the bony structures. I'm going to palpate the scapula first, the spinal process, and the posterior ribs. Was any of that tender?
No.
Okay, no tenderness reported, and I felt no deformities or any no abnormalities. I'm now going to listen to 10 points on her back with the diaphragm, and then afterwards I'm going to listen to the lateral sides. And I'm listening for lung sounds. Okay, I heard no adventitious sounds on the back 10 points or the lateral sides. I did 4 on the right side because of the extra lobe on the right side. The lungs were clear and clarity and everything. As I said, no adventitious lung sounds. Was the scapula or anything tender? Okay, I can't remember if I reported that. I'm now going to move to the abdominal region. Can you lay down for me? First, I'm going to inspect. The skin is evenly distributed. It's symmetric. There's no lesions, no scarring. I'm going to look down. I don't see any pulsations, no peristalsis, no bulging. So now I'm going to listen to the bowel sounds in quadrants 1, 2, 3, and 4, starting with 1 for 15 seconds. Okay, the bowel sounds were normoactive. I didn't hear any abnormal sounds. I'm now going to listen to the epigastric region for the abdominal aorta. Okay, it was had regular rhythm. Heard no bruit. I'm gonna palpate the abdomen now. Was light palpations. Any of that tender?
No.
Okay, no tenderness reported. I felt no masses, no bulging, anything like that. I'm gonna now do the umbilical region. I'm gonna palpate that. Okay, was any of that tender?
No.
Okay, no tenderness reported. I also felt no masses or bulging there. I'm gonna have you sit up and we're gonna test your range of motion. Okay, first I'm gonna I'm gonna do your upper extremities. I'm going to inspect first. The skin is evenly distributed. I see no scarring, no lesions. The arms, elbows, and wrists and hands are all equal and bilaterally. I'm going to feel. Okay, the skin is warm, moist, and soft and smooth in texture. I'm gonna palpate for edema. Is any of that tender? Okay, no tenderness reported and no edema reported. I'm gonna have you do your fingers together. There's a diamond in between her fingers so that there's no clubbing. I'm going to look at her fingernails. They are clean, cut well. Clean nails shows good hygiene. I'm gonna do the capillary refill. Okay, less than 2 seconds, which is good. Her nails are also strong, they're not brittle. Now I'm gonna have you do active range of motion. Can you do your shoulders, okay, elbows, and wrists? Did you have any tenderness with that? No. Okay, I'm gonna do the passive range of motion. Okay, I'm gonna do this side. Any tenderness with that? No. Okay, she has full active and passive range of motion. No tenderness, no crepitus in either one of those. I'm gonna have you do your arms for me. Push against, pull, squeeze my fingers. Okay, she had a 5 out of 5 muscle strength bilaterally. I think I got everything done there. I'm now going to do the lower extremities. Okay, first I'm going to inspect. The skin is evenly distributed. There is a scar on her right knee due to a surgery. Okay, we're going to measure that. It is 6 centimeters long. Other than that, there's no other lesions, scars, or bruises. I'm going to feel for temperature. Okay, she has warm, cool skin, warm, moist skin with smooth texture. I'm gonna palpate for edema. Any tenderness there? Okay, no tenderness or edema reported. There's also no discoloring in her legs. I'm gonna check your feet and your heels. Her heels are smooth and soft, no lesions, no fissures. They're well kept, which also indicates good hygiene, along with her toes, which we're going to inspect. Her toenails are clean and evenly cut. Her nails are not brittle, they're strong. I'm going to do capillary refill. Okay, less than 2 seconds. And I'm going to go ahead and have you stand up for me. We're going to do active range of motion. Can you do your legs? The other one. Do your ankles. Okay, can you do a squat? Okay, was any of that tender? Okay, can you sit back down? Actually, I'm going to have you lay for me. You're going to do your passive range of motion. Okay, I'm going to start with the hip, do knee, and then ankle. Okay, do hip, knee, and then ankle. Okay, any tenderness there? Okay, both passive and active range of motion. She had full range of motion in both. No crepitus, no tenderness, no popping. Now that I have got that on, I'm going to do your muscle. Okay, push up, down, Push out, pull in, up, and down. Okay? Her lower extremities, we're 5 out of 5 in muscle strength. No complications there. And I'm gonna have you stand up for me, and I'm gonna have you bend over in front of the camera. We're gonna check your spinal process. For any signs of scoliosis or kyphosis, there's no curvature of the spine, which does not indicate kyphosis or scoliosis. Okay, you can sit back down, and I'm going to check my card to make sure I have done everything. Okay, so whenever I was doing her chest, I did say some of them, but I did not see any retractions, paradoximal movements, or sighing, and I also did not see any thrills, heaves, or pulsations in the anterior or posterior chest. And I think that I'm done.